All right. Hello. Welcome to another Arthritis Wellness Conversation. I'm your host, Sandra Sova, and as always, I am joined by a research scientist from Arthritis Research Canada and members of the Arthritis Patient Advisory Board. On the panel joining us today is Dr. Deborah Da Costa, and from the Patient Advisory Board, we are joined by Shannon, Trish, John, and Christine. Welcome, everyone. Great to have you again here for another conversation. Our topic today is one that I absolutely love, and I know that many of you do too, and that is resilience. How to maintain a positive outlook when living with a chronic illness. So there's a lot of things for us to touch on and as we get into this conversation, but I thought it would be a good place to start if Dr. Da Costa, could you give us just a little bit of an outline of what is the definition of resilience from a clinical perspective?
Absolutely. Even psychologists don't always agree on what resilience is, so I'm going to go with the American Psychological Association's definition, which I agree with and I think has the most support. And in that, resilience is seen as a process whereby we adapt well when faced with adversity, when faced with significant stress. So living with a chronic condition such as arthritis, which we are faced with physical, psychological, and even socioeconomic impacts. These are numerous stressors that individuals must be able to adjust to. So it really involves the ability of bouncing back when faced with adversity, and some would go even a little further in that in addition to bouncing back, it's also viewed as an opportunity for personal growth. So learning something from the situation as well.
Yeah, for sure. I mean, that's a good description of it. I thought we'd go around the panel and check in. What do you folks feel when it comes to the different definition of resilience? John, I'd like to start in with you. You said being able to overcome downers.
The idea of sort of educating yourself to overcome negative situations is actually a process that everybody should go through, regardless of whether they have a chronic illness or whether they, have little downers in their lifestyle. And the idea of educating yourself to do that is really, really important in my mind. You've got to brace yourself and prepare to do that. And one of the areas that I found to be extremely useful is getting information on what's causing your problem, whatever your problem happens to be. And it's quite interesting to watch people go through this process. For example, if you're diagnosed with cancer, the immediate shock of that diagnosis is a real downer. Most people really struggle with that kind of diagnosis. But if you get into the process, and I've been through this process myself, of finding out exactly what your disease is and how it's likely to affect you and what the possible remediations are, it takes a whole lot of stress and negativity out of the situation and gives you something to hold on to and look forward to. And so the idea of gaining information is, in my mind at least, one of the most important aspects of overcoming negative things, negative information, negative diagnoses. So I think that's enough for me.
I think there is, I agree with John, there is knowledge or finding out about your condition, but there's also tools and techniques that you can learn from different organizations like the Arthritis Society or from physiotherapists or occupational therapists, where you can develop skills that will help you with managing the disease or anything that comes up. But it is, as John said, it's a constantly changing thing. So you have to be able to adapt. And even if you develop skills and you start to have a positive outlook on things and then have a roadmap or goals set for you to move forward, you have to keep adjusting them because your environment changes around you. So there's different things that are going to impact that, whether, just like recently, people's ability to be resilient with the disease and handling rheumatoid arthritis with COVID, and also with economic conditions and things like that. So to me, it's a constantly learning thing. You're learning about how you can deal with things and trying to investigate or get tools and techniques to help yourself.
With this ever constant changing environment, definitely living with a chronic condition, living with arthritis is something that is changing. I'd like to ask, do individuals feel that their ability to be resilient, did that change after your diagnosis? And do you feel that something like resilience is something that we can actually develop and learn?
For me, I've had arthritis for over 25, 30 years. So when I was younger, in my late 20s, early 30s, I didn't even think of resiliency. I didn't think of my mental health. I didn't think of mood changes and all the other parts of living with a chronic disease. I focused on the physical changes, the joint pain. I focused on mobility issues. I focused on that. And that's what I stuck to. And I never really realized how much living with a chronic disease and the stress really impacts your mental health. And then all of a sudden I started to find I had mood swings or mood changes. I started to feel the depression or the fog or funks. So then I started to learning, like John said, educate yourself, like what's happening, why is this happening, what can I do? And that's when I started to hear about resiliency. And I would say my resiliency has changed over the last 20 years because I'm learning more about taking care of my mental health, not just my physical symptoms, my physical challenges.
Shannon, you had mentioned that you didn't really notice a change so much with your diagnosis because you sort of needed to become resilient early on.
Yeah.
And did that work out to be sort of a skill for you in living with
I didn't know that I had it.
Yeah.
I didn't know that's what I was doing.
Yeah. Mm-hmm.
But it became even more intense, of course, the requirement for it with the diagnosis and receiving, I say, the gift of a social worker through the Mary Pack program was one of the things that really, really, really helped me with that.
Mm-hmm.
Yeah. Having somebody to talk to and just have, a chat, not be, not someone who's analyzing you or, giving you more information than you can handle that maybe it doesn't pertain at that particular time. When you've got a social worker who specializes in working with people with arthritis, it was really, as I said, a gift. Yeah.
I really like what I'm hearing from you in terms of resilience being something that changes and that grows over time. And in fact, we do see that. The other thing, historically, resilience was looked at as a personality trait. You either had it or you didn't. Mm-hmm. But now it is seen as a dynamic concept that is constantly changing as we experience and gain new skills. And when we overcome negative events, we become more confident because we see that, hey, I was able to master that, even though, being in that situation was really hard, I overcame it. It gives us a sense of mastery, which also increases our resilience.
There's a meme that goes around, that's been around, and it says, if you look at your track record for surviving hard days, it's 100%.
Mm-hmm. Mm-hmm.
Yeah.
So I'll have to remind myself of that sometimes, but it is a good reminder, that you will get through it, and the next day will come, whether you want it to or not.
And the thing that I'm always reminded of is when living with a chronic condition is chronic by definition means ongoing or constantly reoccurring, and so that's one of the things that we tend to being able to find ways to be resilient is very helpful and supportive, because when stuff keeps coming our way, being able to deal with that. Let's talk about a positive outlook. Do we believe that a positive outlook helps to contribute to being more resilient?
I think it's a small component.
Yeah, I think the same thing. I think it's a part of it, but optimism, and I think of joy and hope So I think it's in a bigger package. So positive outlook is just one component of the whole big picture.
Shannon, you had mentioned something about the 7 C's.
Oh, can you remind me what they are? Because I wrote
Sure. You had mentioned the concept of the 7 C's, which are competence, confidence, connection, character, contribution, coping, and control. And what I'm hearing in that is that we are also reminded that we're not in this alone, right?
Mm-hmm.
That you brought up social worker, you brought up having these conversations, being able to learn that. Positive outlook is having that hopeful, being able to see beyond a current struggle situation that we are in. And I just like some of the words that I've been hearing, like joy has come up, and presence, and those sorts of things. What about the opposite? What if you yourself, or the community we're around, or the world that we're in, does a overbearing negativity, a negative attitude, impact your ability to be resilient?
I think so.
I think so. And I think you have to pull on what you've learned through your life, to pull on those strengths as you move forward, so that you can, have little goals to look forward, or little things that you can do to make yourself feel better. Feel like you're moving forward instead of just staying or moving backwards.
Absolutely. It can be extremely draining to constantly be focused on the negative aspects of a situation. And it doesn't leave any energy left to problem solve and to, do what you need to do in order to get through the situation.
I think everybody knows, or they know themselves, that, through the last 2 years, for example, when it's been especially challenging, that we and other people have said that they've had to stop watching the news, or they limit their access to information because they just are tapped out.
Absolutely. It is one of the strategies that we have recommended to people in order to better cope with this ongoing situation, is to not be constantly checking the news. And now with social media, we're constantly being bombarded with updates, whether we like it or not. Turn those off. It's too much, and it becomes scary.
It can hopefully remind us during those challenging times that, as Shannon said, that we do have a good track record of getting through these times. And then one of the things I think that is important, someone did mention previously, not paying attention to the mental health aspect of living with a chronic condition. And as you go along, when you become an experienced veteran and you start being able to say you've done this for a decade or so, paying attention to the mental health aspect, that fits into the resilience category. Who can speak to that?
Go ahead.
Go ahead, Deborah.
The studies show, both in arthritis and in other populations, that people who are more resilient have lower rates of depression, lower rates of anxiety. They sleep better. There's less fatigue. There's even some signals that it's associated with less disease activity. So really building up resilience has both physical and mental health benefits.
I think you also have to be aware, because in the early years of my arthritis, I was a bull in a china shop. I pushed through a lot of things that I didn't realize what I was going through at the time, and I just pushed them down, and I focused on other things. I did try to stay positive, even though I was struggling. But I think self-awareness is really important, because all of a sudden you can like, oh, I didn't know I thought that way, or I didn't know I didn't deal with my emotions, or I didn't know I pushed that away. And all of a sudden you start to be more vulnerable, I think also accountable to yourself. And also, if you have a group of people around you to support you, they can notice when they're starting to see changes in your ability to function with day-to-day stuff. So I think for me, it was self-awareness was the biggest thing, because before that I was one of those no pain, no gain, push through it. I'm young, I can do this. I'm not going to let this beat me. And I just kind of put up the blinders and just kept on running. And so now I'm in a different place, that I feel all the different components of my mental and physical well-being are interconnected, and that I need to put as much focus on the mental side as I do on the physical side. And a lot of times they're subtle, and then all of a sudden one day they're a little bit more of a wave or a tidal wave. So I think important is self-awareness, and then just learning about what you need and how to cope with them and get tools. So I think I remember learning years ago about mindfulness and learning about meditation, but do you think I applied them? Because I didn't think I needed them. But nowadays, I'm in a different phase or more realistic. I notice things, and I'm now applying things I learned years ago that I didn't apply then, but I'm applying them now.
Mm-hmm.
I totally agree with Trish. I mean, self-awareness is a big thing, and I think that comes with age, and also comes with a lot of courses that you can take on understanding your personality and how you deal with other people and how you deal with conflict as well, because that can cause stresses in your life. And being also realistic, and don't punish yourself if you can't get done a list of activities that you had selected, or you write down a list of things you want to do on the weekend. Don't punish yourself if you don't get them done. Accept what you can do and say that was a good day and I got these things accomplished, not the negative part of it that I didn't get these things done.
Yeah.
So it's accepting what you can do at that point in time, and it's going to change. You'll have good days and you'll have bad days.
Mm-hmm.
I think the other word beside self-awareness I learned in the last year or so was being kind to myself. Because I used to beat myself up, if I make a mistake or something happened. I used to be very hard on myself. And now I think that's really important, is being kind to yourself and also knowing your limits and also how to protect and pace yourself, and say no and not feel guilty about not able to do things. So I think a lot of the mental health is finding boundaries, learning about your self. And I think the one thing I've really focused in 2022 is trying to be kind to myself.
Mm-hmm.
Go with it. Bounce back, but just go with it. Just, don't try to fight it.
One of the best examples of how self-awareness and positivity and so on can affect your performance is in the sports world. I'm watching the Australian tennis Open these days, and it's really interesting to listen to the announcers talking about the players that, one player will be down on themselves and they're exhibiting all sorts of negative body language, and the other player will be going through a period on the court where they're very positive about the way they're feeling and so on. And you begin to realize that people who can pump themselves up completely on their own and have a strategy for doing that perform better. They don't get injured as often. They generally are healthier. There's all those aspects coming into it, and you can see it right out there on the court. It's kind of amazing. And sort of you watch players longer term, they go into downturns and then upturns, and it's all seemingly related to exactly what we're talking about here. It's quite interesting in my mind. And when you're dealing with a disease, it's the same thing. I've had the same issue as Trish did. I started to show symptoms of psoriatic arthritis back in 1985. The disease itself was really only designated as psoriatic arthritis in the year 2000. And my actual diagnosis of psoriatic arthritis didn't happen until 2015. But, I had already started to develop a strategy for handling it by sort of treating the symptoms incrementally as things went along. And I think that's one of the things that really shows up in this whole resilience equation, actually able to handle these things on your own, provided you have this resilience factor that you're talking about. And mental health is really a very important part of the equation, because downers and uppers and all of these kinds of things are all tied into your mental health, but they're also very, very important as to how they are going to sort of promote or help you handling the disease. It's all tied in. It's all really, really important.
All tied in, the physical and mental resilience. Absolutely. It seems like it's something that everyone is conscious of and always trying to build and to bounce back. Deborah, is there anything currently going on in the area of research with resilience?
I think that in the next year, we're going to see a lot of information come out with respect to resilience in the context of arthritis, because there's been a number of studies launched in the last 2 years, and most of us who are looking at the mental health piece have incorporated measures of resilience now for the first time. I took a peek at some of my own data prior to our talk today, and found we're following both lupus patients and patients with rheumatoid arthritis, and we're showing that those who are more resilient have lower rates of depression, as we expect, of anxiety, and less stress with respect to COVID and being worried about it. And we're going to follow people over time and see the changes and what factors are associated to those changes. But I think that there's some exciting work that's going to come out.
That was such a great point that you made, Trish, when you were initially diagnosed. You were asked if you had stress in your life, and you said no.
Yeah, I didn't recognize it. I think also too, people correspond stress with negative, like I didn't have any major trauma in my life. There wasn't a lot of difficult situations. Everything was kind of positive, because like having a new family, and we're just doing things. But positive stress can be just as important to understand and work through than some of the negative stuff we go through.
Mm-hmm.
But I think for me I was that type of person. I was a former athlete. I pushed through things, and I had my mental ability to kind of compartmentalize things, and I was able to go through things. And then all of a sudden, I got to a point in my chronic disease, arthritis, that I couldn't do that anymore. It wasn't working for me. That trick, or how I managed it, wasn't working. And then I had to figure out new ways of working with it. So to me, I still remember the day my GP asked me if I have stress in my life. And I was like, no.
I think that in the model of care, it would be really important at some point, like in the first 6 months, 6 to 9 months, that there's a mental health check-in, after your diagnosis.
Absolutely.
Would be a really important component.
I think that another part of attitudes and anxiety is how other people treat you. And I think perception is a big thing. And, I've been living with arthritis for close to 40 years, and people see me walking around, they think, and I'm doing Pilates, I'm doing some exercise, I go downhill skiing, but I've stopped. But, I would be doing things that they think that normal people would do. And then they would make a comment, or they would bully you if you park in a handicapped spot. And they don't realize, well, maybe you look normal to them at work, or when you're seeing them when they're doing an activity, but they're not seeing you the rest of the time when you can hardly get out of bed and you're in agony in the morning or all night. So it's people's perception that also can be very draining. So you have to develop your own resiliency on how to handle people's perception. So, you have good days and bad days, and, it's the nature of the day, of the disease. It's always changing.
The person I am when I go into Costco is different than the person I am when I come out, I have to say. It's that rapid.
I think also
That's
too
so
is we
true.
put up a protective shield around us.
Yeah.
And we only let so many people really in and see the real us. And that could be for various reasons, not just our arthritis. Some days I was really good. And then the next day, for no reason at all, flip a coin and I'm, not doing well.
Yeah.
So it was kind of like there was no progression. Like, you have an ankle sprain. You can see that the ankle's sprained, it's bruised, it's swollen. You've got, you're using a crutches or canes or whatever, and then it slowly gets better.
And you know why it happened.
Yes. Whereas this, one day, for no reason, I'm struggling, and the next day I'm doing fine.
Well, I'll share with you on my recent trip, I was with 8 other people, And there was a couple of people that said, I'm getting a better idea of what you deal with day to day because I'm seeing you every day.
For the whole.
Yeah.
And I'm seeing the activity and how the activity affects you, or how the rest is, what the rest does for you, or the day that you're taking steroids, you know, so that I can be included in the activities that were planned. So that was a real, I think, eye-opener for a lot of people that perceived me one way and then saw me day to day.
I agree with Trish. I mean, early on when I was first diagnosed, I didn't want my arthritis diagnosis to affect me progressing in my career. And so I would feel like I had to work harder than everybody else, and I worked longer hours, put in more overtime, so I could prove that I was just as good as everybody else. And unfortunately, I think a lot of us are probably type A personalities, so we work even harder just to cover the whole thing up. And then eventually you come to the point when you have a major flare and you just can't do it anymore.
I think that's another part of being resilient, is you learn about empathy. And I think that's one of the things I've learned over the last year or so, is looking at things differently. I found the turning point in my mental health and my understanding and working through and starting to do new skills or new tools to be able to manage my arthritis and become resilient or more resilient. And I'm still learning. Part of it is my son. And then also too is learning new words like being empathetic. So.
One of the interesting aspects about what you're talking about here that I've felt through my career is that as a result of having issues myself, I was able to understand how other people were having problems. And it's kind of ironic, but you know, because you're going through a bunch of things that maybe not everybody else is, you begin to realize that everybody has some kind of issues, some kind of problems. And I found it very sort of interesting to kind of analyze what other people are going through with their lives. And very often I get into conversations like, you know, somebody will tell you that they've got a problem with a knee. And, you know, you start talking to them about it a bit and you begin to realize that they've obviously got osteoarthritis. And you can empathize with what their issue is. You begin to realize that this resilience that we've been talking about today is something that some people don't have, and they don't realize that you need it in order to get through these kinds of issues. And so I found that there's a two-way street on all of these transactions. You have your own problems, but you've got to figure out what other people's problems are as well. And it makes your life a lot more interesting and actually a lot more fun if you can kind of start sharing problems with other people and maybe help them solve their problems. And very often in doing that, you'll find that you solve some of your own problems.
In fact, it does help build resilience, not only getting the support from others, but as you said, John, helping others, helping others both with informational support, just listening, the emotional support, that helps them. And it also helps you in that, you know, you've done something valuable, something that can make a difference in somebody else's life.
Feel like you're contributing.
Exactly.
Yeah.
Absolutely. This has been a really great conversation on resilience. I thank you so much. Well, I'd like to thank everyone for their participation today. It is always great to have these conversations and to have an opportunity to put this out there so those that are watching can hear from people just like them living with arthritis. Thank you so much. And for more information, you can check out arthritisresearch.ca.